Hello, everyone. Good evening, Professor Connors. Good evening, fellow classmates. My name is Clive Perry, and I will be doing a presentation about evidence-based practice and how it applies to leadership in nursing. So the first question that comes to mind is, what is evidence-based practice in nursing? Now, evidence-based practice in nursing is a systematic approach that uses the best available research, clinical expertise, and patient preference to make informed decisions. The goal being to provide the best patient outcome or the most desirable outcome for the patient. Now, the next question that comes to mind is, who is a leader? Or more so, who makes an effective leader? There are several words that we can use to describe an effective leader, right? A few words that come to mind is person who communicates well, who is self-aware, who's resilient, who is accountable, dependable, who encourages others to get the task done, right? I'm pretty sure there are a lot more words that I can use, or a lot more words that you, the viewers, could use to describe an effective leader. Now, I found an interesting article that's about bridging the gap between theory and practice. And I found this article very interesting simply because, even for me personally, I had no prior knowledge coming into the nursing program, nothing about the nursing field, anything like that, right? But then going into the program is like I was introduced to basically the building blocks that allowed the nursing field to be what it is today. We learned about the basics, and then transitioning from the theory aspect, which is what we learned in school, to the practical part of it, the actual practice, where we went to first clinicals, and then we actually graduated nursing school and actually went into the working world. We saw differences, but at the same time, everything that we learned in nursing school can be applied directly into our jobs. And now every decision that is made, whether it is based on individual or collective or even a leader, which is what the focus is for this video, a leader has to have evidence, has to have research, has to have proof that a decision that is made is the best decision that is going to achieve the best desirable outcome for whoever is involved. Not just for themselves, not just for the patient who is directly involved, but even as far as family members. And even it can be as drastic as affecting the organization as a whole. But regardless, an effective decision is made simply because efficient, due research was conducted, and then a desired outcome was achieved. Now, transitioning from theory, nursing school, to practice, working world, we had to gather evidence. Again, evidence-based, okay? And then we had to develop our critical thinking skills. So it's not just about gathering evidence, but it's even knowing how to apply it. So right off the bat, we can see where critical thinking skills is applied directly into our job. We have to know how to prioritize. The first thing that we learned in nursing school was about safety. And then we learned to prioritize, we learned about medication. There's a systematic approach in how every topic is being introduced, or was being introduced rather, to us as students. And then we're able to capitalize, we're able to build, we're able to mold our own train of thought into being the best version of ourselves. Now, the beauty of this nursing field that I find so interesting is that even though there's a common goal, which is to achieve the best outcome for the patients, it's like we have so many different routes that can be taken in order to reach that goal. So it's not a one size fit all type deal. It's like you have your own way of thinking, and then once we have the building block, which is the knowledge, the education, then we can be able to steer the direction that we want to go in order to get that desired outcome. Now, talking about us as nurses being in the working world, we have a task where we are challenged to make decisions, critical decisions, because we have basically the life of another person in our hands. At the same time, we have the responsibility of managing our team. Now, with that being said, choosing the correct leadership style is very critical. And without evidence, we cannot make that informed decision. We have to learn our team. We have to learn who we are working with in order to achieve the best outcome. Again, that's the goal, right? But the thing is, it's not a one size fit all type deal, because what works for me might not be the same thing that works for another person. We are all humans. We all have different likes, different dislikes, different ways of communicating, and so we will respond differently. So as a leader, we have to know our teammates. We have to know who we are working with in order to choose the right approach in order to get the communication or the cooperation that we need in order to reach that goal. So even us as nurses, nurse leaders, can you imagine making a decision that negatively impacted somebody else or even an organization, and knowing that it could have been avoided if due research was conducted? This is exactly where due research is needed. We need to have evidence in order to support our decision. So right there, we can see where evidence is needed in order to make the most effective decision. Because if we did not do research and we did something and then we found out that this could have been avoided because somebody else did this, the mistake was already made, then we could have avoided an entire mistake altogether. We'd have been able to choose the correct method, choose the correct path, choose the correct outcome, make the best decision in order to get the best outcome if research was conducted. Now, in conclusion, based on everything that was said, everything that was presented, it is evident that we need evidence in order to make informed decisions. As nurse leaders, we need to be educated. We need to use available resources. We need to do our own due research in order to avoid making mistakes that has already been made, and in order to capitalize on our own growth, and in order to achieve a desirable outcome for patients and every single person involved. Thank you so much for your time. Thank you for watching this video, and I hope you have a good evening.